If I had to explain analytical development in just one sentence, after years of working across discovery, clinical development, and late-stage programs, this is what I would say. It's not a definition pulled from a textbook, but a guiding principle shaped by real-world experience, by successes, and, let's be honest, by learning from things that didn't go as planned. It's the core idea that, once you grasp it, makes everything else in this complex field click into place. So, what is that sentence? Analytical development is the discipline of generating the right data at the right time to support the right decisions across the entire drug life cycle. Simple, right, but every word there is critical. The right data, the right time, the right decisions. Everything else we do, every method we run, every spec we set, flows directly from that single, powerful idea. Now, why does this matter so much? Because most problems in drug development don't actually come from a lack of data. They come from data that's misaligned with a decision that needs to be made. We see data that arrives too late to be useful. Data that asks the wrong question entirely. Or, perhaps most dangerously, data that creates a false sense of confidence where we should still be acknowledging uncertainty. Getting this alignment right is everything. Let's break it down by stage. In discovery, analytics is all about learning. Its purpose is to guide our direction, to highlight emerging risks before they become major problems, and to support a culture of exploration and innovation. At this early stage, analytics isn't about achieving certainty. It's about generating insight and fostering informed curiosity. We're asking, what could this be? Not what is this exactly? Moving into early development, the role of analytics shifts. Here, it's all about enabling key decisions. Is the material we've produced suitable for what comes next? Do we understand the key risks well enough to proceed? Can the program move forward both responsibly and safely into the next phase? At this point, clarity matters far more than completeness. We need clear answers. 2 focused questions. As we approach the IND in Phase 1, analytics starts to quietly shape the program's timelines. In very real ways, things like method readiness, setting initial specifications, and ensuring release confidence become paramount. The choices we make here, often under immense pressure, determine whether a program moves forward smoothly or gets bogged down by avoidable delays right when momentum is highest. This is where proactive analytical work pays off. Then, as programs mature into mid-development, analytics has to evolve yet again. The questions get more complex. Comparability becomes a critical theme, especially if processes change. The narrative we've built around impurities needs to mature and become more robust. And those early assumptions we made, they have to be revisited and challenged. What worked perfectly fine before may no longer be sufficient as the complexity and scale of the program increase. By the time we reach late-stage development, analytics transforms into a system. The focus shifts to consistency, trending data over time, and maintaining tight control. The goal here is a reliable supply chain and predictable performance, batch after batch. At this stage, analytics is less about discovering something new and more about protecting everything we already know, ensuring that the product delivered to patients is the one we intended to make. So, let's be clear about what analytical development is not. It is not a quest for perfect, flawless methods. It is not about generating infinite amounts of data just for the sake of it. And it is absolutely not about trying to eliminate all uncertainty. Pursuing those goals is not only unrealistic in real-world development programs, but it's often counterproductive, wasting time and resources on the wrong things. What it really is, at its heart, is a discipline of judgment. It's about understanding the context of your program. It's about knowing what truly matters right now and what can safely wait until later. It is the art and science of matching your analytical effort to the maturity of the program and the specific risk of the decision you are trying to make. This is where strong analytical leadership becomes so important. Great leaders in this space create clarity. They expertly align the scientific reality of the molecule with regulatory expectations and the practical constraints of execution. Most importantly, they prevent their teams from getting caught in the trap of doing work that feels scientifically rigorous, but doesn't actually move the program forward in a meaningful way. The most common failure I see is when analytics drifts away from this core purpose. It happens when it stops serving decision-making and becomes an end in itself. When the act of just generating data replaces critical thinking, that's when progress slows to a crawl and risk quietly starts to build up in the background, often unnoticed until it's too late. So, remember the unifying principle that holds true across discovery, development, and commercialization. Data must serve decisions. As long as analytics stays anchored to that fundamental purpose, it will always create real, tangible value for the program, for the company, and ultimately, for the patients we're all working to serve. In this first series of episodes, we've explored how the role of analytics evolves across the drug life cycle. We haven't treated it as a simple checklist or a rigid set of rules, but as a flexible thinking framework designed to help you make better, more informed decisions at every single stage of the journey. In future episodes, we'll dive deeper into more advanced topics like late-stage analytics, inspection readiness, and navigating complex, real-world case studies. If you work in any aspect of drug development, mastering this way of thinking about analytics will serve you incredibly well, no matter what program, team, or decision you're facing. Thanks for watching, and I'll see you in the next one.